So, good evening to all of you. And today we welcome you to a very interesting topic of understanding stress as well as mindfulness, which is a tool to deal with stress. So, for the next 1 hour, I shall be taking you through this very important understanding. And I am Dr. Anirban Pal, and this workshop is organized from Harmony, which is a meditation center by medical experts. And this workshop is a part of the series of workshops we are conducting for the last few months. And the focus of these workshops are mostly the healthcare providers who are associated with healthcare, who are always caring for the people in our society, but unfortunately, there is no one to care for them. So, with this special focus, we are trying to organize these workshops. Now, coming to stress, which is a very important concern to all of us today. In our everyday life, all of us, we are facing this problem of stress. So, fortunately or unfortunately, very frequently I need to meet people and talk with them. So, I find that stress is a major player today in our society. And all the lifestyle diseases and the different problems which we are facing, stress is something which is behind all this. So, those who are in some sort of hectic professions, so they would be always complaining that my professional life is stressful. There are so many things I have to deal with. I have to deal with different complex situations and people, and all this is causing me stress. And those who are in different relationships, they would be just saying that the different relationships which we are presently moving through, these are causing stress. It can be our families, it can be our friends, and maybe our spouse, our children. So every one of us, we are much bothered about this, that the relationships and in addition, we have health issues. So many of us, we are suffering from different health problems. And some of them are major problems or quite concerning problems. So all of this together, and how to deal with these problems, and many of us, we are taking a number of medicines or taking a number of therapies through which we are trying to handle this problem. So all these are making our life quite difficult. And these things are actually creating a large amount of stress in our life. So today's workshop is the aim of today's workshop is to give you a different perspective towards stress. So if you look at the very definition of stress, you will see that it is your response to some difficult situation or challenges. That is how the stress is very simply defined. So one thing I think you should be, as you look at this definition, or as you look at stress, you will see that this is not the situation or the challenge, but something which is more important is your response. So if those who have joined this particular workshop, if I give you a difficult situation to each and every one of you, so our responses to the situations will be different. And that defines stress, not the situations. So I may give you a very challenging situation, but maybe one of us or some of us will be responding to the situation in some manner that may not account to stress. So it's quite interesting. If you can understand this basic mechanism of it in a lucid manner, I think all of us, we can handle stress in a better way. So instead of just complaining that it is the profession or it is the relationship, it is the health issues, it is some other challenges, it's better that let us try to understand what stress is and how we can handle it better. So just moving forward, I will start with a real life story. Just I will share with you an example taken from my real life, and I will request all of you to just imagine yourself in such situations, or you can imagine your own stressful situations. And as you start understanding it, probably you will find out that there are different ways of handling it. Okay. So this story starts like this, that one day I was going to my hospital. So this is an incident a few months back. So I'm an anesthesiologist, and usually in the hospitals I work, I have a list of cases. And every day I report to the hospital at a particular time. And when I reach the hospital, I have a few cases to give anesthesia to. So quite similar to wherever you are working, you should be having a number of patients to see or to cater for, or certain fixed jobs you need to handle. So my hospital was maybe some distance, and I was driving my car and going to the hospital, and some patients were waiting there, and their operations will be starting at a fixed time. Now, what happened as I was going on my way, suddenly there was a malfunction in my car. So the tire of that car got punctured and some other mechanical faults happened. So the car was not moving, and still I have to cover 20-30 minutes of distance to my hospital. So it was midway somewhere. And because of this problem, I knew that I couldn't reach to my place of work at that time. And also at that moment, I cannot connect to someone who could help me out in that situation. So I would request all of you to imagine such situations in your life. I think all of us, we have faced such situations where it becomes very difficult how to handle those situations. We call this as triggers. And very frequently in your life, you will see that such triggers, they appear in your life. Maybe you will see them coming almost every day or alternate day in different forms. These triggers are hidden in your professional places, or maybe where you are communicating, or when you are talking to some family member. Okay, some arguments pop up, or the triggers may be different, but these are very common. Now, this incident happened. Now, next thing what happened was I understood that within next 15-20 minutes, I cannot reach my hospital. So that is a serious concern. And so many patients are waiting, and other people, the surgeons and other people are waiting, or they would be starting the cases, and it will take me quite some time to handle the issue. And I cannot also leave my car in the midst of the streets in such condition. So I should need some time to handle the car also and do something with it. So just imagine the situation. And the next thing what happened was certain changes inside myself. So if you can just look at this picture, you will see certain areas are pointed out. One area you can see is marked in red color, is the amygdala. So this part in our brain, it gets activated. Amygdala is the emotional center of our brain. So it gets activated in such situations. And it sends some signals to another part, which is marked in blue. It is called as hypothalamus. Now, this hypothalamus, once it gets activated, it activates a series of reactions inside our body. And there is an axis called as the HPA axis, that is the hypothalamus pituitary adrenal axis, that gets activated. And what happens next is certain hormones are secreted inside our body. And these we call as stress hormones. So quite interesting that hormones like cortisol, adrenaline, this gets secreted, and certain changes happens in your body. So I was feeling those changes, and all of us, we can just relate to those changes, because once we get into a stressful situation, what we actually see is these changes. So the first thing I felt was palpitation. So my heart was beating fast. And no one recorded my blood pressure, but I'm sure that blood pressure should have been shoot up in that situation. So I was feeling very anxious. I was sweating. I was irritable. I didn't knew what to do, whether to take care of the car or to call up somebody and handle the situation at the hospital. And the whole situation, I was getting a headache. I was breathing fast, and I didn't know that what to do in that situation. So I was almost panicking in that situation. So this is just a real life example of what is a stressful situation and what happens to us. So I think all of you can relate to this. The triggers are different. It changes from time to time in different circumstances. But this is the physiological thing that actually happens. The triggers the amygdala, that is the emotional center in the brain, which further activates the hypothalamus, and then it activates and secretes some hormones in the body, and certain changes happen in the body. So in medical terms, we call this the fight or flight response. So those who are doctors or those who are associated with the medical profession, this is nothing new for them. The flight and fight response, all of us, we know this. Okay. So till now, I think all of us, we have understood that what stress is, and this is happening to many of us very frequently in certain situations where we are being triggered. Okay. From now on, what I am going to tell you is something which perhaps many of you have not heard before. So, till now, what I've said is the things which are found in the books, or this is known to us from our medical books or our medical knowledge, or these things are discussed. But the next part of the session, we will be telling you something which is not usually discussed, or which people don't know about stress. So this is how the flight or the fight response is activated inside us, which is also known as the stress response. Now, just think that why is this fight or flight response is there inside us? This is a protective response. We are all human beings, and we are put into different challenging situations. So our body has an inbuilt response, which we call as the fight or the flight response. This has been inbuilt inside our systems to help us from very critical or danger situations. Because if you are facing a life threatening situation in your life where your life is at threat, you need this response. You see? So this effects which are ultimately happening, that you need a faster heart rate, you need a faster BP. So basically, the circulation in your body is getting increased. All the muscles are getting adequate blood flow. So in such situations, there is a threat to your life, and you need to fight. That is, you need to fight with the person or the people or something like that, or you need to run away from the situation to help yourself. Okay, so the whatever changes is happening in your body is just to prepare yourself in that danger situation so that you can save yourself. Now there is a major problem with this. So what is the problem? The problem is that a few days ago in our hospital, a fire alarm system, okay, it was instituted, a new fire alarm system. Great. So if there is a fire in the hospital, the alarm will start ringing. Now, once it was installed, this fire alarm system, from next day onwards, whenever we are working in the hospital, time to time, the fire alarm system starts giving an alarm. So obviously it's a fire alarm, so there must be fire. So everyone goes on panicking out that there is a fire in the hospital. And then we found out that there is no fire. So there is a problem with the newly installed fire alarm system, where the fire alarm system is giving false alarms. So there is a low threshold of the alarm, or it is so sensitive that some minor changes which are happening, it is taking it as a fire and it is sending out an alarm. Okay. So once we understood it, that okay, so many alarms throughout the day and none of the time there is no fire. So we informed the authority, and those who installed the system, those people came and they did something, reset the alarm, and the problem was solved. This brings in a very, very important lesson for us. The same thing is happening with us. This thing which is visible to you, this step by step process of stress response, is perfectly okay. It's taken from the medical books. There is no problem with it. But at the same time, there is a major problem with it, because the response that is being generated inside you, in 95 to 99% of the cases, this is a false alarm, which your brain cannot understand most of the times. So you are responding to some false alarms in your life, and you are getting stressed. So just coming back to the situation or the real life story from where we started. So I was going to my hospital in a car. In the midway, there was a malfunction, and I understood that I cannot reach my hospital on time. There was a number of patients and other doctors there waiting. And as I understood that I cannot reach there was a stress response that was activated inside me. There is a simple story I told you. Okay. And all of you can relate to similar simple stories in your life where you got stressed because of certain situations or certain people or certain circumstances. Okay. Now, this is a false alarm. Why? Because this is not a life threatening situation anywhere, and these responses are not going to help me. So having a faster heart rate or a higher blood pressure, becoming much anxious and irritable with a lot of just panting, and having a headache is not going to help me in the situation. So the response which has been generated inside me just by activating this fight or flight response through my brain system, through this different areas which I mentioned, is not going to help me in the situation. So it's just a false alarm. The body has falsely read that I am into a life threatening situation, and it has reflexly generated this stress response. And these things are because I'm not going to run away anywhere, and neither I'm going to fight anybody in that situation. It has falsely raised this alarm, and I start panicking, or you start panicking in such situations. Okay. So it was a false alarm. And if you look at the stressors, if you look at the situations which make you stressed, you will see that more than 90% of them or 95% of them, there is not any threat to your life, but your body or your brain is reflexly generating a fight or flight response, which we also called as the stress. You are getting stressed. So it is not helping you in the situation, these things. Rather, it is harming you in the situation because you go on activating this stress response again and again, very frequently, almost every day or alternate day or a number of times in the week or once in a week or number of times in a month or very frequently in a few months. So obviously after some time you will be suffering from chronic stress, and this chronic stress will result in different lifestyle diseases. So the most of the diseases which we are suffering in our modern society, stress is a major component, or stress is something who is a major contributor in those diseases. It is a long list of disease. It starts from hypertension, diabetes, sleep problems, pain problems, GI problems, a lot of them. It's an endless list of diseases. Most of us, we are suffering, or our family members are suffering without understanding that something is happening inside us. There is a problem with the false alarm. The alarm which is being generated, just think of the situation in our hospital. An alarm was installed and it is giving alarm very frequently. So everybody is thinking there is a fire, but actually there is no fire. The same thing is happening to us. There is not a threat, but the body perceives that there is a threat and it starts reflexly doing something. So you perceive that there is a fire because the alarm is ringing, and you start with the fire drill. That is what is happening. So here you need to understand this a little more, and then you can understand that how you can debunk this false fire alarm or this stress thing. So let's start to understand that how you can manage stress. So unless you have a good idea that why this stress is happening, you cannot manage it. And most of us, we have this misconception that we cannot do anything about stress. So people come to me and they will be always complaining that you know my situation is so bad, I cannot do anything. Okay. I work in such environment, such toxic environment with such toxic people that I cannot do anything. I have this professional stress. Or there is something happening in my family. I am into some such complex relationship and such problems that I cannot do anything. I am stress is something which is inbuilt in my relationship. It is not like that. Or someone would say that I'm suffering from such and such problems, such and such diseases, that obviously I am getting automatically stressed. The thing is not like that. It is your response. It is not the problem in the profession. It is not the problem in the family. It is not the problem with some other people. It is not the problem with your disease. It is how you are responding to the situation that is stress. Just think of another person in similar situation. That person is not getting stressed. Same situation. I can tell you just one instance. Today I went to the hospital, and along with I had another of my colleague. And today we had a very difficult patient to give anesthesia to. That patient has a cardiac problem, major cardiac problem, and a lot of things. And both of us, we have duties in the same OT, and we are just co-consultants. So as we went on to give anesthesia to that patient, what happened that I have arrived a little earlier. So I have planned in my mind all the measures, extra measures I am going to take for that patient. Okay. I have the best people in my department helping me. I have called them already previous night. I've arranged them, and the other equipments or the special things I would require for this patient. I make sure that this patient has a ICU booking, and the risk is being transmitted at the start of the operation. I communicated all the risk to the patient party and explained them in details that what is going to happen, what measures we have taken, but in spite of that, what is going to, there can be certain problems with this patient and everything. Okay. And when I started with the procedure, I explained each and every person who are there, all the risks, and this case is a very special case. Everything was taken care of, and everything went very smoothly. Now, my colleague, is he appears to the scene or the scenario. He is just panicking. We have already started anesthesia to that patient, and everything is going fine. So he comes just running and panicking, and he says that, yeah, such and such things happened today morning. I was planning to come a little earlier, but something I got late, and then again I just run through the stairs and I have reached here. Okay. And he was just panting. Okay. And then he comes and he says, the whole night I was thinking about this patient, and I have not slept also. I was, so I said that you just relax. So everything has been arranged. What measures we need, we have already taken. So you don't need to be so much in such a panicky situation. And I am hopeful that in the next half an hour, the operation will be completed and everything has been arranged. So the patient will be transferred to the ICU, and the ICU people, they will take care of the patient. So you don't worry. So the next half an hour, he went on just worrying that what is going to happen, what is going to, sometimes the blood pressure is dropping a little, sometimes some other problems are happening. So he's just panicking. Okay. So you see that two people in same situation, but the responses are totally different. So one is just taking care of what should be done, the actual measures or the actions one should take for the safety of the patient. And another person is just only worrying and thinking that, oh, and just panicking throughout the situation without actually doing anything. It's just making everyone around him more stressed and just transmitting the panic to everyone without actually helping the situation. So your response is the most important and the most critical thing. It is not the difficult situation or the challenge. So let's understand it a little better. So in the stress management or in the stress response, there is something called as the perceived threat. Please look carefully. This is not a threat. This is a perceived threat. So it is your perception of the threat. Just coming to this story which I said just now. So there is a critical condition of the patient. The patient can have major problems. So it is a threat. But you see, the perception of this threat is different for me and my colleague. So that makes a lot of difference, a world of difference, how you look or you understand your threat. So here you can do something to manage your stress. So the thing is not universal, the threat is not universal, it is your individual perception. It differs from person to person, if you understand that. It is not that, yes, there is a definite threat, but how you look at the threat and what you do regarding that is very important, how you respond to that threat. The next thing is there is certain things happening inside your brain. So there is another misconception that we cannot do anything about this. So your emotional center, which is the amygdala, the red part, is getting activated in certain threats, and there certain signals are being sent to the hypothalamus and certain changes are happening. So this is the processing center which is inside yourself. So you can do something here also, which is happening inside yourself, inside your brain. There are certain things which can be changed in this part also. Okay. It sounds very strange, but actually it is possible for you to do those things. Instead of just complaining that I'm so stressed, and there is so many things happening in my life, it makes my life such miserable. You can actually work here also in these areas of processing in your brain. And the final part of it, where the signals have been sent and certain hormones are released and certain changes are happening in your body. So this third part, when already the stress hormones have been released and certain things are happening in your body, you are having a fast heart rate or you are having a high BP and you are sweating, you are panicking. So this is the most difficult part to change. So there already the response have been given. And most people, we try to modify the third part of it. So once you are already in a panic, then you think that what I can do or how to actually do something to just come out of this stress response or this panicking response or whatever is happening inside my body and mind. So if you understand the stress response and its management, you will see that either you have to do something in the first part where the threat comes, okay? How you perceive the threat, there you have to take some measures or you have something to do out there so that that response is not generated. This false alarm doesn't happen. So you do something, you modify that threat, or you do something in the next part, which is the processing center, the amygdala and the hypothalamus. You do certain things which modify this part, the processing center, so that the stress response or the false alarm is not activated. So your area of work is not the last part where already the hormones have secreted and already you are in a panicky state, or you are anxious, or you are extremely bothered. Okay. So please correct yourself in understanding this. So you have to act either in the first part, where the threat part, or the processing center part, to handle or manage your stress response. Okay. I think this must be clear to all of you who are listening. Okay. So now let's try to understand that this perceived threat part, how uh, you can handle it. So some information comes to your body and mind. It is important how you handle that information. Okay. So your handling of the information is very important. It differs from person to person. As I said, that there is nothing called as universal. It is your perception. So you can look at the situation from a very different perspective. Suppose let's take some situations, and this will make the things more clear to you. The real life story where my car broke down at the middle of the street and I couldn't reach my hospital where a number of patients were waiting. So there is a problem with the car, and there is a problem with my doing my duty. Okay. So an information, a threat was sent to my brain that I will not be able to reach the situation. So there will be a chaotic situation in my hospital. So what can I do? I can, instead of getting into a stress response, the information that is coming, I am perceiving, okay, I can handle that information a different way. So what the next thing I do is I call up one of my seniors or another colleague and say that, look, I am into a very problematic situation in the street. Suddenly this sort of accident has happened, that my car has broke down. I need your help. Okay. This can happen. If I cannot reach out to my senior, I can just call my head of the department or someone more senior persons or someone in the administrative posts, and I can request help from them. Sir, I am into this problem and please help me out of this situation. This is nothing, non-intended thing, and it accidentally happened. Okay. So maybe someone will be available, or someone may just uh, help me out in that situation. So some other people will be reaching that scenario and helping me out. Or I can just inform the surgeon directly that, sir, this things has happened, and if you can just help me out. So you see, instead of panicking, there can be certain way outs, or if I am unable to reach them, I can just call up the technician who will be helping me that, look, please transmit this thing that I will be late by 1 hour because certain things has happened. Okay. So you see, there are different ways of dealing with the situation, with the threat. So suppose that part is taken care of, my hospital duty is taken care of for an hour, someone else comes and handles it, or this information has been given to the patients and everyone, the doctor was coming, something has happened, so he is late. So if you can please patiently wait for an hour, and we will start all the procedures within an hour, or we will have some alternative arrangement, so don't worry. Okay, you see. So instead of just panicking out there, so many things can be done just by handling the situations. And handling the information, sometimes it so happens that you cannot do it actually. So perhaps I tried all these things, still I could not do anything, or I could not reach out to other people. Okay. So even then, there is a way of changing my mindset and looking at the situation from a different perspective. So just think that what you can do. You are strangled at the middle of the road. You cannot leave your car out there. Just leave the car, and if possible, that can also be an option. So if you can just drive a little and uh, your car to some place, and you take another vehicle and go to your hospital, and then you come back after some time and take care of the car. Even if those options don't work out, you have very limited options. And in certain situations of our life, it's also so happens that you need to accept a lot of situations. Yes, there will be a chaos. I am trying to communicate. And later I will be just explaining that, yes, this has happened because of such situations. One of my colleague, just a few months back, one fine morning, he was just diagnosed with a cancer disease. So he just came to the hospital and he was having a regular health checkup, and an ultrasound was done, and suddenly a mass was found. So one fine morning, everything was all right in his life, and he found that he is being suffering from a pancreatic cancer, and that cancer has already spread to different parts of his body. So just look at the amount of threat. And he goes to a doctor, an oncologist, and he says that, sorry, sir, you have hardly 3 to 6 months in your life. So sometimes the threat is such great. So in 95% of the cases, these are only false alarms. In certain cases, the intensity of the threat is so much that it is, in still that situation, there is something to do. You can look at the situation from a very different perspective. So you still have 6 months left in your life. So you have a lot of things to do. And just yesterday, that person called me and said that when I first heard the news, I was totally panicked and I didn't know what to do. But today, I am feeling a lot relieved because I have been to a number of experts, medical experts, and they are saying that it is not that big a threat. Yes, you have the cancer, it has spread, that is good. But we have the modern medical treatments. So the your treatment will be continuing, and you can go to other places and you take those different therapies, and it is not, your life is not so limited. Okay. We hope that you will be living at least 2 3 years and even more. Okay, you see that a lot of things in our life which we cannot solve directly, we have other ways of looking into it and dealing with those situations. So we can reset our minds or try to look at situations from a different perspective. So that is the threat part. The next is the processing center. So a lot of things we can do also, so that this amygdala, it becomes less active, it becomes calm, and maybe other centers which are more logical centers in the brain system, or which determines our action. You remember two anesthesiologists which I told, that when acting differently with a critical patient, because the one who is panicking is actually acting from the emotional center of the brain. Is just when the amygdala is hyperactive, he is just panicking through without actually doing. And the another person is acting through the prefrontal cortex of the brain, is cool and calm and doing what is needed in that situation without panicking. Understanding that yes, such critical incident can happen any moment, and the things can change any moment. Just accepting those, but what is presently needed in the moment is necessary to do. Okay. So if you understand this a little, we will be now talking that what measures you can take to handle your stress situation. And please remember that once the hormones have already secreted and already the changes have started in your body, there is very less things to do actually. So either you have to do in the first part when the body perceives a threat, or your existence perceives a threat, or when the things are getting processed in your brain. So these two will be the major parts where you will be doing certain things or certain measures you will be adapting in your life to handle your stress. So just coming to this, what can be your stress management methods? And please remember that when a stimulus comes or a situation comes, Usually this whole things, they happen within a quarter of a second. So everything happens very fast. That is another problem. It will not give you a lot of time to think and rethink and look at different perspectives. So the things has to be ready, or your thought processes or your clarity of the situation has to be already there, so you can just put in different processes and help yourself in stressful situations. I think the first thing I have already spoken a little, handling the trigger. If you can just remind yourself, for more than 95% of the cases, the trigger which is coming to you is not something which is life threatening. So you are panicking or you are getting extremely stressed in certain situations. Just ask yourself, whatever information you have received or whatever trigger is there, is it causing a threat to your life? Just ask yourself. And in most of the cases, the answer coming out from you will be no, it is not a threat to my life. I taught this to a young lady. So, a lady came to me. She was only 17 years old. Okay, she was a teenager, and she was having panic attacks in her school. So she was in the high school. She was getting ready for the boards, and she was brought by her father to me and to learn mindfulness and those things. And I asked her, "What is your problem?" She said that, "Sir, whenever I face certain situations in my school or I meet some teachers in my school, I get into panic attacks. So certain things, my heart rate goes up and I start trembling and start sweating and I get into panic attacks, different sort of thing. And number of times my father has taken me to the hospital also. And then the hospital people in the emergency, they treat me and say that nothing has happened. A lot of examinations happen, ECG and other things. And after some time, I have been admitted for a few hours and then I have been sent back to my home saying that I'm having a panic attack." So I said that you start doing one thing. I explained her the process of stress response and stress management in very short. I said that you ask your, yes, you ask yourself that, is it a life threatening thing for me? Probably not. Probably not. Most of the answer, you just ask yourself that, is it threatening my life? Is it a threat to my life? If the answer is no, so that's then what is the point of panicking and just generating the response? Just stop the response out there. And after 2 weeks, this little lady, young lady, she came back and she said that, "Sir, I have come out of my panic attacks because every time this response is there, the trigger is there, I am asking this question, and in 99% of the cases, the answer is a no from inside me. So obviously, the trigger doesn't get into this long response thing. All the things are not happening." So if you can just ask yourself that what is good you are going to do with just being so anxious and tensed and those things, and being so in such situations so stressful, so you will have your answer at that moment. Just ask yourself, what is the use of getting into in this form. So you are just making sure that your alarm is false one. It is not a true alarm, and the flight or fight response doesn't need to be activated. If it is a life threatening situations, then this fight or flight response will be extremely helpful for you. It's a threat to your life, so you need to run away or you need to fight with someone else to save yourself. Other cases, more than 95% of the cases, 99% of the cases, if there is a no coming from inside you, then no, it is not a life threatening situation. I have mentioned two situations today. So neither of them were life threatening. My car was, there was a problem with the car. That is not a life threatening situation. Some problem will happen with my professional place. That is not a life threatening situation. I have a very critical patient to deal with. That is not a life threatening situation in that way. Life threatening to the patient, but I have taken all the measures I could have taken in that circumstances to save the patient. Okay. So nowhere there is any threat to life. So nowhere there is a role of any stress response. So just handling the trigger well. The next thing is the mental reframing. I was telling you about this. When you think deeply about certain things, you will understand that all the problems in life doesn't have a solution directly, but they can be dealt with in different ways. There are different perspectives of looking at situations. So how you look at a situation, that is not the end of the world. There can be many more ways of approaching and looking at situations. And here in the session, I have given you different choices or different ways through which you can mentally reframe the situation. If I could have handled it, I have these options for me. And similarly, you will be having a multiple options for yourself. And if those options even don't they work, if the situation is extremely morbid or very serious, then also you will be having certain options. You can wholly accept the situation. Okay, this is going to happen, and what can I do in this situation? So let the chaos happen, and then I will handle it. I will see that what happens. So you see the mental setup is totally different. The mindset is totally different. You allow the things to happen and then you look at it. So there is no such situation where you have no options. There will be always some ways of looking at it, some ways of looking at the situation or handling the situation. Okay. So this is another option. If you can handle the trigger at the first instance, that is well and good. That is the best thing. If you feel the trigger is too overwhelming, you will be having this option of mental reframing still there. Your second guard. This will depend on your understanding of life. This will depend on how deep a person how you look at your life. This is a little deeper thing. This is not superficial. The second part, the mental reframing part. How deep you are as a human being, that will be taken up by the second thing, mental reframing. Now comes in mindfulness. Still, now we have talked nothing about this. Okay. So our session was understanding stress and mindfulness. So let us start understand a little bit about mindfulness. So what is mindfulness? It is an observation of your thoughts and feelings which are arising inside yourself. And it is something to stay in the present moment through different methods. Okay. So this is a very, very, very short explanation of mindfulness. Okay. Now, what mindfulness actually does is, already we have mentioned two ways. Within mindfulness, these two ways are already incorporated. So it helps you to see what is happening inside yourself when a trigger is there. How your mind reacts to that trigger, you can observe, because that is what mindfulness is all about. It is an inner observation of what is happening inside you every moment. So once you understand that there is certain different things are happening, there are options of mental reframing, because in mindfulness we teach you different virtues and different things where you are encouraged to take different perspectives to the situations of your life. And mindfulness does three very important neurobiological changes in your mind. Many of you must be thinking that how the processing center can be modified. The second part was the processing center, which is the amygdala and hypothalamus and other centers. Actually, mindfulness can change those centers. So, the three important changes which mindfulness does, the first one is it calms down the amygdala. Amygdala is the emotional center of our brain. It calms down the amygdala. So you will not be over emotional. Many of us in our modern lives, we have very low threshold to stress. So very small triggers can actually trigger us. So minimal triggers, minor triggers, someone saying something, some minor changes happening, you will be seeing that you are getting angry or you are getting stressed. So you have very low threshold. So what mindfulness does, it makes you a little less emotionally reactive, or you are emotionally hyper reactive. It calms your amygdala, so you become less emotionally reactive to all and every of the stimulus. The next important thing it does is reinforces a part of our brain called as the prefrontal cortex, which is a very important part of our brain, which actually helps us to take decisions and actions. So instead of just panicking, you will be doing the things that need to be done. There is no point panicking. There is no point giving into a stress response, just only breathing or having a very high heart rate on sweating and just panicking around and just feeling anxious. So these things are not going to help you. You need to call a few people, you need to ask for help, you need to seek help in that situation, and you need to arrange certain things or you need to modify the situations. So that is action. That things, those are coming from the prefrontal cortex of your brain. So mindfulness activates the prefrontal cortex. And the third thing it does is it decreases the self talk. So if you see your mind, the mind is always talking without any reason. There is certain talk which is going on inside yourself, and you don't understand the why this talk is going on, and what is the purpose of this talk. Why this bullshit is going on inside my head all the time. So mindfulness addresses this self talk. The more you practice these techniques, you will see that the self talk, this useless talk which is going inside, will decrease. So it actually helps you to handle stress in multiple ways. And many of us, we have a misconception about mindfulness. We think of mindfulness because certain things are popping out all the time in our internet and in this world we live, and we think that we know everything about mindfulness. Oh, it is about keeping the mind in the present moment. Oh. So I think that I am into a branch of anesthesia, So here, unless you practice for at least 2-3 years, you are under some training, you are not allowed to anesthetize some patient. So suppose someone, it happens in our society, comes into anesthesia training and just takes just a superficial idea of anesthesia in 1 month or 2 months, and that person goes out and goes to deliver anesthesia. What will happen? Utter devastation. Will go on killing patients without understanding anything. That person will go out and will start killing one patient of the other. The same thing applies to mindfulness. Those who think that you know something about it, it is something which is a very deep thing. You need to go very deep into it. You need a lot of practice, a lot of understanding, a lot of deeper getting into to understand what is actually happening. So those who think that just from some podcast or some internet content that you know mindfulness, actually you don't know anything. The same thing happened with me when I started with mindfulness. Everyone starts with the internet resources. And when I got into a proper course of mindfulness, after maybe 1 or 2 years, I understood that for the last 2 years, what I thought that I knew about mindfulness, I knew nothing about it. But I thought that, oh, so many things coming up, so many people saying so many things and so many facts. Actually, it is nothing. Rather, it is creating more misconceptions inside me rather than knowing the actual thing. It's something, a deeper practice, deeper understanding. It's a long process to understand it. Okay. And in this context, I would like to say that those who would actually want to learn it or start learning it and want to practice it, it also needs a long term of practice also. So there is a proper scientific training, which we called as the beginners batch or the beginners program, is going to start within a few days. So you can just connect with me regarding that and get into proper training of this so it can help you out. Okay. So it is a major tool which can actually help you understand the whole stress scenario and help you to handle the stress from inside yourself, because you are an observer of the things that are happening inside yourself. And as you observe the changes, it is, you can just stop in different parts so that the stress response doesn't happen. You have the options. You are given a choice to just stop it there. The false alarm you can stop at multiple points once you become an observer of your own thoughts and feelings. In addition, there are other methods also. Okay. So it is not that there is only mindfulness and there is nothing else can help us. So many of you are into the field of psychology or other things. So obviously cognitive behavioral therapies and other different therapies, stress management exercises are there. So those things can also help you if you can apply in those critical situations. These are very difficult to apply because everything is happening within a quarter of a second. So very fast things happen. So if you have that mastery over any of the technique, I can just tell you one which is very popular. It is called as the 4-7-8 breathing. It's a special type of breathing. There are different types of rhythmic breathing. In mindfulness practices also, we do certain rhythmic breathing practices. So this is another type of rhythmic breathing practice. So what is this? This is, you take the breath to the count of 4. So you count 1, 2, 3, 4, and you take a breath to the count of 4. Then you hold the breath to the count of 7. You count 7 and you hold your breath. And then you release your breath to the count of 8. So this method, which is called as 4-7-8 breathing, this is a scientific method of dealing with your stress. So if you are into a stressful situation, some triggers have happened to you, and you are getting into the stress response pathway, you can just deactivate that pathway. Just close that alarm by starting with this 4-7-8 breathing. Okay. This is scientifically proved to help in stressful situations. You can try it out yourselves. You will find audios of this available in the internet and more contents on this in the net. You can search it out. Even if you even don't need to search it out, you can practice it out. Just count 4, take the breath, hold it for the count of 7, and then release for the count of 8. Okay. If you are into the scientific training of mindfulness, you will already get into a number of methods, different rhythmic breathing methods, which are equally helpful in such situations. Okay. So I think these things we have tried to discuss as your stress management methods. But unless you understand the whole thing, it's difficult to actually apply them, and your time is the most vital thing. You have very less time in that moment, in that situation. Okay. To just sum up the whole session, just the take home points for all of us. I think this discussion must have been helpful for those who are listening to it. I have tried to give you the actual scenario of stress and how you can handle stress better. So please remember that it is happening in 3 phases. First is the trigger part, where the information or the trigger comes. The second part is the processing part inside your brain. And the third part is the response or the changes which you see inside yourself or you experience. So first thing you need to understand, the third part is the almost the non-modifiable part. There you have very less to do, because once the hormones are secreted or once you are already into the response, very little you can do about it. So you have to take the first part. Either you have to handle the trigger, or you have to reframe it mentally and look at the trigger. So there is a lot of work you can do in the first part, and don't activate the false alarm. Don't activate the stress response. It is not helping you in most of the cases. The second part, a lot of things can be done. The processing center is there, amygdala and hypothalamus. So here, the meditations, they help a lot. The mindfulness thing, they can actually cause changes in these areas. So that can also be done if you want regular practice of this and understanding this, the processing part. And you can also take care of other methods also. Different breathing techniques are there, so you can use them at stressful situations. As I mentioned, 4-7-8 breathing is a form of rhythmic breathing. You can use it in stressful situations, so you can help yourself out of such situations. I'm already over my time in this online seminar, in this online workshop. So I'd like to thank all of you and hope whatever has been discussed will be helpful for your real life stress situations. All will depend on your application, your understanding of the situation. So once you understand the whole situation, try to use this in your life, and hope this will help you to handle your stress better in your lives. Thank you all for joining in today's online workshop. We hope to continue with more informative workshops like this in future. Thank you once again. Thank you.